Hello, my name is Claire McFadden, and today we are having a webinar regarding conflict of interest in case management. We're providing this webinar so that people can have information about the way that the Developmental Disabilities Services Division is considering making changes to the way case management is offered in developmental disability services. And we want to describe all the options that are being considered and then get public input on those options. So that is the content of this webinar. Again, my name is Claire McFadden. I'm the Developmental Disability Services Director. And we will now proceed. I want to thank Kirsten Murphy of the Vermont Developmental Disabilities Council for helping to design the slides to make them accessible, and hopefully they're understandable. So, what is the rule that we're having to follow now? In January of 2014, the Center for Medicare and Medicaid, also known as CMS, they issued some final regulations on the home and community-based services requirements. And what do these CMS regulations say? They cover quite a number of things, but the first is they talk about how services are supposed to be provided in a person-centered manner, and that there's a requirement for person-centered planning in the delivery of services. This means bringing people together who know a person really well and finding out what that person wants from their life, and that they're at the center of that decision-making process. They also ensure that people receive services in the most integrated setting and that it's of their choice. The rules also define what it means to live in a home and community setting. They also encourage community participation. And lastly, and this is what we're going to be talking about today, they talk about case management being provided without any undue conflict of interest. So we're going to talk more about what that means. So when did this requirement go into effect? So some parts of the CMS rules don't go into effect until 2022. The federal government has given states a period of time to evaluate how their systems comply with the rules and have allowed states to have a transition plan to come into compliance with the rules. But the requirement for case management being free of conflict of interest has actually been in effect since 2014. But in practice, CMS is allowing states time to make the adjustments to come into compliance. So our target date is actually, we need to submit our plan to CMS about how we're going to address conflict of interest in case management by January of 2021. So we're trying to get input now to make decisions about how we're going to move forward and then get our plan approved by CMS. So here's what the rule says. I know there's a lot of words on this slide, but in essence, what this rule says is that whoever provides your direct services, so in Vermont, some of the direct services include employment, like home supports, crisis services, clinical services, and things like that. Those are some of the components of home and community-based services for us. And right now, case management is also provided by agencies. So agencies are providing both case management and all the direct services. So what the rule says, though, is that case management and direct services need to be separated into different provider agencies. So this would represent a fairly big change for Vermont. There is in the rule an exception that we could ask for to CMS, and that is we would have to demonstrate that a provider in a certain region of the state was the only willing and qualified provider who was available to provide both case management and direct services in that region. And if we were able to demonstrate that there was only one provider available and willing in an area, we would also have to include some additional conflict of interest protections to show how we're addressing conflict of interest. We're going to talk more about that in a little bit. So what is a conflict of interest? It's when a decision maker is pulled in two directions because of conflicting duties. So for example, a case manager has a duty to the individual that they're the case management for, and they also have duties to their agency. And sometimes the interests of the agency and the interests of an individual who receives services could potentially not be the same interests, and therefore it creates a conflict for that case manager. So who are they going to basically which boss are they going to be listening to and advocating for? So here's another example of potential for conflict. So right now, when somebody comes into services through their designated agency, the agency could potentially just refer the person for direct services to their own agency and not provide information about the full range of options that the person has. So for example, in Vermont, we have options for self-management, where a person can totally manage their own services without an agency. There's shared management, where you share some of the responsibilities for managing services with the agency, and a person could manage them themselves, or you could seek to get a different provider than the designated agency to provide your services. So there's potentially a conflict if the person does not get information about their full range of options, and an agency is just referring a person to what they have available within their own agency. Another potential area for conflict of interest is around quality oversight. So for example, in Vermont, because the case managers work for the same organization that employs the direct service providers, there's a possibility that a person might not be particularly satisfied with something that's happening within their services, and so they go to their case manager and say, issue their complaint about what's going on, but because those workers are co-workers of the case manager, or they're actually even they're direct reporting to that case manager, the case manager may just go easy on their co-workers in getting the issue resolved, and not be advocating on the behalf of the individual who's brought up the complaint. So that's a potential area where conflict occurs too. The other possibility is that an agency may steer people to certain resources, particularly ones that may just be readily available instead of listening to the full range of what a person is saying that they're interested in. So they may just steer people to certain resources instead of explaining the full range of options. So that's another area where there's a potential for conflict. So I just want to make clear here that the way that services are set up in Vermont, with case management being provided by the same agency that provides the direct services, this has been in place for years and years and years, 4 decades now. And we're not trying to imply that agencies have been doing anything wrong. They have been providing the services in the way that the system has been set up. However, what's changed is that the federal government and CMS, who are the funders of home and community-based services, have made a change to the rule, and they're asking us now to consider other ways of organizing case management. And so that's what we're exploring here, is how case management could be set up in Vermont to reduce these potential conflicts. So let's take a little bit of a dive here into how case management is working in Vermont and what we heard during phase 1 of exploring how Vermont was going to address these potential conflicts of interest. So this is what we've done so far. We, as a state, have taken a look at where there are potentials for conflict of interest in our Developmental Disability Services system. We've provided information to a variety of stakeholder groups and asked for some initial feedback. The Commissioner of Dale went to the Green Mountain Self-Advocates and talked about this issue. We have spoken to the State Program Standing Committee for Developmental Services about this on a number of occasions, and sought their feedback. We have sent out information to our agencies and asked them to reach out to people and explain what this is, and I'll give people an opportunity to provide feedback. This information was presented to the Developmental Disabilities Council. So there's been a variety of venues to get information out and seek some input. And so we did receive some initial input, and we have summarized those comments, and I'm going to go over those as well. And then based on the comments we received, we've drafted some ideas about how to address conflict of interest in Vermont. So here's some of the things that we have found are potential areas for conflict in the way that Vermont's Developmental Disability Services are set up right now. All 15 designated agencies and specialized services agencies do provide both case management and direct services. Only those people who are totally self-managing and get support through Transition 2 have their services set up in a way where case management and direct services are not provided by one organization. All of our agencies do develop the plan of support for a person, and the 10 designated agencies are involved in conducting those initial assessments of need, and they develop proposals for how much funding a person needs to have their identified needs met. All of our agencies conduct periodic reviews of what people need. So at least once a year, they review whether there needs to be any adjustment to their plans. And then they the agency adjusts the level of funding to be consistent with what a person needs. So they are involved in that. And then our 10 designated agencies also provide information about a person's choice of agency providers and their options for managing their services. Again, whether somebody wants to self-manage, have all agency managed services, or they want to share the management of their services. And the specialized services agencies provide this information to people who are already in services as well, so people understand what their choices are. So in any of these areas, there are potential conflicts that can arise. So, like I said, we sent out a request for people to send in comments. And also in some of the venues that we presented this information, we gathered all of those comments, and here's a summary of what people told us. We asked people what works well in case management as it's currently structured, and some of the things that people said were that case managers know people really well, that they have ongoing and regular contact with their case manager, that having the case manager in the same agency as direct services allows for a continuity of care and really good, coordination of all the parts of somebody's plan. And they also maintain the history of that person so that things can be well coordinated. They like that case managers have direct oversight of services, and that the case manager is a point of contact for accountability. So people know who to go to when they have any concerns or issues that they want resolved, and that case manager serves as that point of contact. So those are some of the things that people said they liked. So here's a summary of some of the comments of things that don't work so well or are possible areas of conflict of interest. So we had some comments saying that people steer people to resources that are just familiar to the case manager, especially those that are at the case manager's own agency. People said that they don't feel like they necessarily learn about the full range of options that are available to them. They indicated that the funding might be the driver of decisions rather than the needs of the person. We had some comments that case managers may be unable to advocate on the behalf of an individual, particularly if the interest of the individual conflicts with something that's an interest of an agency, or at school team meetings. So then there were some things that people identified that were related to quality, such that individuals or families weren't being involved in reassessments, those periodic reviews of what a person needs, that the planning was not always person-centered. We have heard input that sometimes the agency may just develop the ISA without any input from the team and just ask people to sign an ISA that's already been developed, which would not be a person-centered planning process. That there's high turnover of case managers for some people, and that that doesn't work very well. The new case managers don't know people very well, and that the ISA goals don't always reflect the goals of the individual receiving services. So those are some of the things that people said that were not working very well. And we asked people also what they had for suggestions for addressing conflict of interest. And here are some of the things that were identified. We got a suggestion to have independent assessors outside of the agency who complete the needs assessment like they do in the Choices for Care program. That's a program for people who are older and who have disabilities through our adult services division. And in that case, the assessments are done by state staff. There's another suggestion to have more choices regarding where people could receive their services and have more choices around providers. In some parts of the state, there really is only one provider providing services in that county. Another suggestion was to make information about all the available options more readily available. There was a suggestion to create a way for individuals and families to share information with each other about services options. Another suggestion was to develop quality ratings of providers so individuals and families can compare their options. A few more suggestions, including enhanced training for case managers so they understand the full range of options available, and to teach motivational interviewing. Motivational interviewing is a technique of interviewing people to really get at what is really important to them. Another idea was having an ombudsman to address quality concerns. So an ombudsman is a person or an organization who you can go to if you're having challenges or issues that you need to get resolved. And it would be an independent person who would help you get your issues addressed if you had concerns about quality. So we don't currently have an ombudsman program in developmental services, so there is a suggestion to create that. Another idea was to separate discussions of money from the needs assessment and the person-centered planning process, to make those processes separated and then figure out the money later. And another suggestion was to have peer navigators to help people understand what their options are, especially for the option for self-direction. So in peer navigation, it would be, it could be family to family peers, or it could be individuals with developmental disability peers who explaining what people's options are to other people who are coming into services or who are already in services and are looking for other options. Another similar suggestion was to offer independent options counseling. So this would be an organization who could, or individuals who could, who are outside of the direct service provider agency, who could explain what a person's options are. Enhancing quality oversight of services would be another option to ensure that services are providing in a manner that reduces conflict of interest, and also to address any quality concerns. Another suggestion was to ensure that appeal rights are being explained to individuals and families regularly or whenever decisions are being made. And then the final suggestion was to separate roles. So the suggestion here is that there needs to be a clean and separate person to do first eligibility determinations, then initial planning about what a person's service package might look like, then options counseling around the full range of their options of providers or management, and then a final more detailed service plan could be developed. And then finally, the selection of a service provider. So those were all the suggestions that we got from stakeholders in our initial round of of soliciting feedback about how to proceed in this state to reduce conflict of interest. So now we're in phase 2, and we're seeking public feedback on potential solutions for Vermont. And so this webinar is part of explaining what the options are, and we are asking for people to provide feedback on the ideas that were generated. So, what is the state doing now to get stakeholder input? So we are hosting 5 forums around the state. If you look below and see that there's a website link below at the Department of Vermont Health Access, and on that site there's an invitation for the 5 forums, so you can see where they are around the state. There's lots of other information on that same website. It has all the information about what the rule is, and the initial feedback from phase 1 is on there, and the presentations that were done to various groups in phase 1. There's also all the materials associated with what we're doing in phase 2, including this webinar. And there's also a feedback form. There is also a link to an electronic survey to provide written comments. So after you hear this webinar, you can go to that website and click on the link to the electronic survey and fill out the survey to provide your feedback about the options that I'm going to be talking about here. There's a variety of ways you can send in your feedback. You can print out a feedback form and fill it out, and you can mail it to the address that's attached at the back of the feedback form, or you can just do it electronically on the survey. So we're actually looking for people to send their comments in by October 7th. So now we're going to talk about what are some of the proposals that the state has regarding the structure of case management. And then I'm going to talk about some other tools that we could put into place to protect against conflict. So on the website, there is a handout that's being given when this is being presented at the forums, but this handout is also on the website, and it is labeled handout 1, but it also has a label called Developmental Services Program Analysis of Proposals to Address Potential Conflict of Interest. And this is a 10-page document that essentially analyzes what the options are, provides a description of each of the options that are under consideration, and also it has some of those additional proposals for addressing conflict of interest that we could add into our proposals to reduce conflict of interest and enhance choice and opportunities for people. So that's an additional document. I'm going to describe all the options, but if you're looking for more details, you can go locate that handout, which describes things a little more clearly. You might also want to look at that document after this webinar as you're getting ready to provide your feedback on the options, it's a good document to refer to as you're putting in your feedback. Okay, so what we're going to talk about first are the case management structure options. So how are we going to structure case management in Vermont in developmental services? So option number one is separation by the state. So under this option, the state would put out requests for proposals to create new case management organizations that would be available in every county of the state. So we would have to develop contracts with new agencies to provide case management. And then case management would be provided by those separate organizations, and then all the direct services would be provided by the current agencies that are in place to provide direct services. So it would be a complete separation of case management and direct services. Now, an important thing that we would need to do if that was going to happen is develop really clear definitions of the roles of case managers and what I would call program managers or service coordinators at agencies, and who is doing what. So when we think about case management, or as the federal government thinks about it, and I'll just make a comment here that in the home and community-based services rules, there are certain activities that they associate with case management, but there is no clear definition of what case management is. And in Vermont, case managers do a lot more than case managers do in a lot of other states. So, for example, in Vermont, case managers are often hiring, training, and supervising the direct services professionals and overseeing the delivery of those direct services. That's not always the case in other states. So what case management is and what roles the direct services provider would have and what roles the case managers would have would need to be clearly outlined and separated if we were going to go with this option. But just to tell you in general what some of the CMS thinking is about the functions of case management, they think about they've specified specifically the development of that person-centered plan. So in Vermont, we call the person-centered plans individual service agreements, or ISAs. So the development of an ISA, the oversight of ensuring that that ISA is being implemented are things that are clearly called out by CMS in their rule. A few of the other things they have identified are determining eligibility and determining what somebody's package of services are. And we're going to talk about that a little bit more later. But in thinking about how these roles might be separated, it's likely that what agencies would be doing would be continuing to hire, train, supervise, provide coverage for individuals. They would be recruiting home providers. They would provide crisis services. They would continue to have a role in the day-to-day support and care and coordination of services for an individual. Case managers would essentially be developing that plan of care and ensuring that people are receiving what's identified in that ISA. So that's option number one, the state separating out case management from direct services providers. Option number two is that we would have designated agencies for each of the counties in the state be responsible for separating out case management from direct service providers in each region. So in this scenario, agencies would get together with their local community and local service providers and figure out how they would separate case management from direct supports in that region. This would allow for essentially more local level decision making about how to meet the requirements for separating out case management from direct services, and it could lead to different solutions in different regions of the state. So one of the issues with this option is that in some regions of the state currently there are no other service providers in a region, and in which case there would have to be some new case management organizations developed for that region. So this option is being presented because this is something that was done in New Hampshire. And New Hampshire has some similarities to how Vermont operates. And so they actually got this plan approved by the federal government. And what they did in New Hampshire was they asked their local designated agencies to come up with the solutions. And in some areas, they were able to say, okay, this organization is going to provide all the service coordination, and these organizations are going to provide all the direct services. In some cases, where there may be, let's say if there's two agencies, they essentially just swapped direct service and case management, so that organization one was providing direct services for people and organization two did all the case management for those people, and vice versa. And then in some regions they had to create some additional case management organizations so that people could get their service coordination from another organization. In some more rural parts of New Hampshire, CMS did allow for 30% of the people to receive both their case management and direct services from the same agency. And we were informed by the Developmental Disabilities Services state people that CMS said essentially that was as low as they were going to go in terms of granting an exception for those regions of the state. So it just gives you an idea about what CMS may or may not approve of. So in those situations where the case management and the direct services were being provided within the same agency, CMS has special protections that are required of the state. They have to have certain strategies in place to minimize conflict of interest. And on this next slide, we'll talk about what those special protections are. So what they say is if direct service and case management are provided by the same agency, there must be a plan for how the functions of case management and direct services are separated within an agency. And some of the examples they've given are that they have to be kind of separate units within an organization that report up to different supervisory levels, so that to minimize the opportunity for conflict. They have also required that there's a very clear and accessible process for resolving any disagreements. This is something that we actually do currently have in place already in Vermont, which is our grievance and appeals process. So that's something that's already in place. They also require that people are provided choice of who their providers are and information about the full range of services that are available to a person. And somehow we would have to ensure that that those options are being provided to individuals, and what our plan was to ensure that people were fully informed. And then the state would have to have some level of oversight where these conflicts exist. So the state, most likely through our, well, there's a variety of ways that could be addressed, but our quality assurance team at the state level would have some responsibility for ensuring that agencies had in place ways to reduce conflict of interest. So anyway, if we were going to suggest a proposal to CMS for their approval that included any option where a person could receive their case management and direct service in the same agency, we would have to submit a plan that describes how we're going to address all of these 4 protections that are required, and then CMS would have to approve our plan. So ultimately, they are the deciders about whether our plan is sufficient to reduce conflict of interest. Option 3 around how case management could be structured includes creating a choice. So what this would require is that case management entities are developed across the state. So then an individual could choose between having an independent case manager from an organization, or maybe an independent case manager, and having their case management delivered by the same organization that provides their direct services. So again, that we would have to create separate case management organizations to be available in each county, and then a person could choose, do I want to have my case management from a separate case manager, or do I want to continue with having my case management provided by the same provider that provides my direct services? In the case where people are receiving their case management from the same organization that provides their direct services, all those required protections would have to be in place, the ones that I just talked about in the previous slide. And we would have to, again, submit that plan to CMS for their approval. The 4th option is basically keeping things as they are, not creating additional case management organizations around the state, but keeping case management with the direct services provider, and asking for an exception to CMS. And in our proposal, we would have to prove that Vermont's designated agencies and specialized services agencies are the only willing and qualified provider in a geographic region, and that all those special protections against conflict of interest are in place. So we would have to tell them what our plan is for addressing conflict of interest, and we would have to demonstrate that there's only one willing and qualified provider in a geographic region who provides both case management and direct supports, and see if they would approve that. So piece of information that you should know is that initially New Hampshire, again, who's very similar to Vermont, they did propose this model and this option, and CMS said no to that, and they had to go back to the drawing board and come up with additional solutions. So I'm just putting that out there because it's unlikely that CMS would approve option 4, although if the protections that we put into place were robust enough, I guess there's some possibility that they would approve it, but the experience of other states suggests that they would not. So there are some additional protections that we could put into place in addition to the ones that are required by CMS, and I'm going to talk about those later. But here's a list of some things that we could do to enhance any proposal that we submit to CMS around reducing conflict of interest. And again, I'll talk about each one of those a little bit more in a few minutes. So again, just so you have this information, CMS approval of exceptions has been rare and pretty limited in scope. So of the proposals the 4 proposals I suggested, only the first one that totally separates case management from direct services is in full compliance with the CMS rules for home and community-based services, and that one would not require us to request an exception from CMS. Any of the proposals that do include where the case management and direct services are provided by the same agency would require us to request an exception. So just to give you some perspective, the National Association for Developmental Disabilities Directors did a survey and got responses back from 45 states. And of those 45 states, 79% of those states already have separate case management and separated from their direct service providers. So only 21% of the states have this the need to come into compliance with conflict of interest, and Vermont is one of them. If you're interested in more information about how other states have dealt with this, on the DIVA website, which I showed you a link for several slides back, there is a link to a webinar that was done by CMS that describes how other states have come into compliance with the rule. And there was some information about South Dakota, which is a state that has a similar overall population, but a much larger territory. And it talks about how they address this issue. And essentially, they didn't ask for an exception, but they decided to develop separate case management organizations for all the regions of the state so that people had, they could get their case management from a different organization than their direct service providers. Alaska did receive approval for an exception, but only in very low population areas of the state. So when you think about Alaska, it's a it's a frontier state. It's very dispersed in their population, and only the northernmost tier of Alaska, which are very sparsely populated, got an exception. The counties that were more populated in the southern part of Alaska did not receive an exception. And then I talked about New Hampshire, and again, they allowed for 30% of individuals in certain rural areas of the state to have their case management provided by the same agency that is the direct services provider. So it just gives you a sense of what CMS has been willing to approve in around this rule for exceptions. So just to reiterate the options, the state creates separate case management. Designated agencies separate case management from direct service providers for their region and come up with a local solution. Choice number 3 is having a choice between having independent case management or case management that's provided by the same agency that provides direct service. And number 4 is the case management stays at the provider agency, and we ask for an exception from CMS and include all those required protections in our proposal. So again, the state is asking for people's feedback. So what you might want to do here is have your feedback form available, and so that you can start to think about the feedback that you want to give us on each of the 4 options that we presented for structure of case management. And again, you would likely want to have out the handout number 1, which has more details that describe each option, and then your feedback form where it asks for specific input to be provided to the state. So if you are looking at that handout number 1, which is the Developmental Services Program Analysis of Proposals to Address Potential for Conflict of Interest, you'll see that the state did some initial evaluation of the proposals, and we looked at some criteria that we developed to analyze the various proposals. We looked at whether the proposal was in compliance with the CMS federal rule. We looked at whether the option was aligned with the initial feedback that we got. We also looked at how much disruption to the system the solution would cause. We looked at whether it might align with any payment reform efforts that are going on with the state. We also looked at how long we thought it would take to implement the intervention, not the intervention, but the solution. We looked at cost, and I want to make a comment about cost. The state needs to really focus in on the cost. Any solution that comes up with, the state will have to figure out how we would cover the costs for implementing that particular solution. What we're hoping to get feedback from you on is what you think is the best solution for people who receive services in developmental disability services, regardless of what the cost is. So we would ask that you really, when you're providing your feedback, keep your thoughts to what do you think is in the best interest of people who receive services. And the state will take responsibility for figuring out how to pay for things. The other criteria that we're looking at was whether the option improves consumer choice and control, and then finally whether it would be administratively complex. So a group of people from the state took looked at that criteria and looked at each of the proposals for the structure of case management and made their assessment. So that's what the handout on page 3 shows, how we scored that against the criteria. And then you'll see on page 4 there are some proposals that are the additional ideas for adding protections against conflict of interest. And again, we will be talking about those in a few minutes, and we rated those as well. Then on pages 5 through 7, there's a more detailed description of the options around case management. And then on page 8 through 10, there are descriptions of the proposals for those additional protections. So again, just thinking about the options, what you want to think about when you provide your feedback to us is looking at each option. And what we want to do is hear from you what you like about each option. So in thinking about option number 1, which is having the state separate case management from the direct services providers and creating new case management organizations to provide case management. We would like to hear from you about what you like about that idea. In addition, we ask for your feedback around any concerns you have about separating case management from direct services providers. We would like you to also provide feedback on option 2. And again, option 2 is having the local designated agencies come up with a solution about how to separate case management from direct services providers in their region. And again, if there's any situation that's a local solution that involves allowing the same provider to provide both case management and direct services, those special protections that are required by CMS would have to be in place. So we are asking you to provide us feedback about what you like about option number 2 and what concerns you would have about option 2. The same, we would ask for your feedback about what you like or any concerns you have about option 3, which is, again, creating independent case management providers in all the regions of the state, and then allowing individuals who receive services to have a choice between having independent case management or having case management from the same provider organization that provides the direct services. So again, we would like to hear what you like about this option and what concerns you would have with this option. And then finally, we would like to hear what you like and what your concerns are about option number 4, which is essentially maintaining case management at the direct services providers and having the state submit a proposal for an exception that includes us showing how the agencies are the only willing and qualified provider in an area, and that we have what our plan is for having special protections in place against conflict of interest. So again, for any of those 4 proposals where case management and direct services are provided by the same agency, we would the state would have to submit the proposal to CMS for their final approval, and it would have to include those required protections that they've identified. In addition to that, we're suggesting some what we're calling stage 2 proposals, which are additional protections that could be put into place to reduce conflict of interest and enhance choice. And so now I'm going to review each of those proposals, and if you have your feedback form available, you can start to think about what you like about those options and if you have any concerns about those options. And again, I would just to reiterate, these are not mutually exclusive. These options that I'm suggesting now as additional protections, we can do one or more of these as potential options. So the first option, which I mentioned a little bit earlier, was having an ombudsman. And an ombudsman is an independent person who does not work for the provider agency, who helps the person resolve any complaints or problems they have about case management or their direct services providers. In this situation, the state would have to develop a contract with an independent organization to provide this service across the state for people in developmental disability services. So if you have your feedback form, you would want to think about what you like about this option or any concerns you would have about ombudsman. Option B is having options counseling or peer navigation. So this option includes having an independent person who helps people understand what their service options are so that they have full, unbiased information from somebody who's independent of any service provider. In this situation, the state would have to contract with an independent organization to provide options counseling or peer navigation. A little bit of difference between what options counseling and peer navigation are. So in peer navigation, the person who's providing that options counseling is, could be a family member or parent providing that information to another parent or family member. That's one kind of peer-to-peer support. It could be individuals who have developmental disabilities providing that type of information to other people with developmental disabilities about what the options are. So that would be peer navigation. In options counseling, it doesn't necessarily specify who the person is that's providing this information around a person's options for receiving services. But it would be an independent person who does not work for a particular provider organization. So again, we would like to hear what you think about options counseling or peer navigation as one of the additional protections. Another additional protection, option C, would be having a options or resource list. And this would be a comprehensive list of programs or services that are available in a more accessible format so that people could easily have that information for what's available in their region. So it would be something that's uniform across the regions and specific to a region. It could include brochures or a dynamic website that potentially you could say, I live in this particular zip code of the state, and what's available to me within a certain radius of where you live. So that potentially could be something that could be make information more accessible and readily available to individuals. And potentially this could be the work to create this resource list and options list could be done by state staff or potentially a contractor outside of the state to do this work and maintain all that information in an up-to-date fashion. So that's option C, and we're interested in hearing what you might like about that option or any concerns that you have. Option D is independent assessment of eligibility for the home and community-based program. So in this option, there would be either state staff or a contractor to assess whether the person had a developmental disability and whether they meet the criteria for home and community-based services. So right now, the designated agencies and specialized services agencies, they arrange for these assessments and then of whether a person has a developmental disability. And then they also determine whether the person meets the criteria to receive home and community-based services. And if they believe that they do meet the criteria for receiving home and community-based services and the person has a developmental disability, then they submit a proposal to the state for receiving funding and services, and the state actually makes that decision. But all the upfront work is done by the designated agencies. So in this scenario, that assessment of eligibility and whether a person meets the criteria for home and community-based services would be done outside of those agencies and could be done either by state staff or a hired contractor. So that is additional protection option D, and we would be interested in hearing what you like or any concerns you have about that option. Okay, option E. This is having state staff conduct the assessment of need. And this is actually what does a person need for services, which is different than whether you meet the criteria for receiving home and community-based services and whether you have a developmental disability, which was the assessment that's done under option D. This is specifically about conducting a needs assessment to determine specifically what the package of services or funding will become available to an individual. In this option, the state staff person would be separate from both the direct service provider and the case management providers. Case managers would still be responsible for developing the detailed person-centered plan. What the needs assessment is focused on is figuring out what a person needs and then that package of support that a person would have available to them to then go to a provider, and the case manager would work with the person's team to create that more detailed ISA. So that's option E, and we would be interested in what you think about state staff completing needs assessments or what concerns you would have about that. Another option would be to have that needs assessment done by an independent contractor. So this would be an organization that would be under contract with the state to conduct the needs assessments. And again, it would be separate from both the direct service providers and case managers. And the case managers would still do those detailed ISAs, but the independent contractor would be conducting the needs assessment that would end up leading to what package of support someone would get. Right now, agencies do complete these needs assessments. And the final additional protection is option G, and that would be having additional training for providers so that case managers have good training around conducting person-centered planning, and also ensuring that people are providing the full range of options that are available within a specific program. So, and again, this could potentially be done by state staff or a contractor to provide this training. So those are all the additional protections that we're thinking about. And again, we like to hear what you might like about those additional protections, or what concerns you have for those. And those are all the options that are on the table that we would like your feedback on at this point in time. So again, just to wrap this up, if you need more information or would like more information about the whole issue of conflict of interest in case management, you can go to the website here that's listed. And as I said, there's all kinds of information about the issues. All the materials that have been used for this webinar are available there, as well as a printable feedback form, which you can print out, fill out, and mail in. You could print out, fill out, and scan it and email it back to the state, or you can go to there's a link to an electronic survey to provide your feedback. Would actually prefer people to do that, so that all that information can be collated electronically. But we will take your feedback however you would like to send it. Also, this webinar is available for anybody who cannot attend one of the forums, and we recommend that people do go through this and listen to the webinar before they provide feedback. If they're unable to attend a forum, so those would be their options. So again, thank you for listening today, and that pretty much wraps up our webinar for the day. We would like your feedback by October 7th, and again, thank you very much.